Well, as the Omicron variant spreads across the country, scientists are racing to determine what kind of protection the vaccines offer.
Just when we thought we might be turning a corner, COVID cases and hospitalizations are on the rise, locally and nationally.
UW Chief Quality Officer Dr. Jeff Pothof is back with us on this Tuesday. Good to see you again.
Good to see both of you.
What is the situation with occupancy at UW Hospital?
So we're really full. During the pandemic, we would have times where we were full. It might be a few hours. We could get people to fit. Now it's not all COVID patients, it's other patients, but there's times where many hours go by before the right ICU bed opens up, which leaves these other hospitals who are trying to transfer patients to big hospitals like UW or Freudert or even Northwestern or the Mayo Clinic in a bit of a lurch as they wait for a bed to open up.
We mentioned earlier in the show that the ICU at Freudert Hospital in Milwaukee is at capacity. So what is happening? Is this a post-Thanksgiving surge?
I don't think so. So part of it is COVID. Our COVID numbers are up, but part of it is all those other people in our community, they're more sick and their severity of illness seems to be greater than it has been in the past. Now, that might be people who deferred care during COVID and now they're presenting later on in their disease, requiring more health care, needing to be admitted. It could be part of the aging population. It could be a bunch of factors coming together, but hospitals are more busy right now than they've ever been in the past.
Unvaccinated patients?
Certainly, preponderance of unvaccinated folks hit the intensive care unit, even general care. We do have vaccinated folks who on occasion get admitted. Usually that's a story of one of two things. One, they're pretty elderly, so 80 plus years old, or we'll see folks, especially at UW, who are post-transplant. They have had a transplant or they have cancer and they're on immunosuppressant. We know that those folks don't respond as well to vaccination, so they do unfortunately sometimes get more sick than the rest of us who do have good immune systems.
Is there any scenario where if you are unvaccinated, it is safe to gather with people over the holidays?
No, that's the short answer. I mean, right now the risk is high enough, and not only is it the risk of getting COVID, but even if you got COVID, hospitals are very full right now. So you might go to your local emergency department and think, I got COVID, but I'll be fine. I'll get in the hospital, and that small emergency department may not be able to find you a spot to go. So right now, with how contagious these variants are, it's really not a matter of avoiding COVID. It's either are you going to get COVID and be vaccinated and see what happens, or are you going to get COVID and be unvaccinated and see what happens.
Have you learned anything new about the Omicron variant?
Nothing that I'd bet the house on, but there's some early reports coming out of South Africa. I think three things. One, it looks like it's more contagious than Delta variant, so easier to catch. Two, it looks like it's at least not going to cause more severe disease than Delta. It'd be great if it's less severe. We don't know that yet. Number three, they do see a pretty high rate of reinfection, so people who've had COVID before, who then come in contact with Omicron, seem more likely to then come down with COVID again.
Oh, that's interesting. So you don't build up any natural immunity if you've had COVID.
Yeah, it seems, or if you build that natural immunity, it's not good enough to be reinfected with this new variant, which looks very different. It seems like your immune system just doesn't quite recognize it because it's got enough changes to sneak by.
So, and the vaccines, we don't know if they work or not against it.
We don't. The reports are that folks that are fully vaccinated aren't necessarily getting really sick. I think that would be good to see continue, but whether you get symptoms or not, what percent of folks who are vaccinated might go on and just develop some symptoms, don't know the answer to that yet.
And can they develop a variant-specific vaccine, or is that a very involved process?
So this is a really good news around having mRNA vaccines. If we didn't have mRNA vaccines, this could take a long time. The mRNA vaccines are actually pretty easy to tweak. The companies are saying about 90 days for them to develop a specific Omicron, maybe Delta vaccine that the next time we get boosters will likely encompass those two variants, so we don't have to worry about them so much.
So stay the course, wear masks around people and distance.
I mean, if it's more contagious, what do you think the next 6 months are going to look like?
It depends. It really depends on how severe disease it causes and how well our vaccines hold up against it. If it causes more mild disease and our vaccines do pretty good, we might have more folks with mild symptoms but otherwise doing pretty well. If it causes same level of severity and vaccines don't help well, the natural immunity doesn't hold up well, we could see more people in the hospital.
Time will tell. Doctor, thanks for being with us today.
Anytime.
You're on vacation next week?
Yeah, we'll miss you next week.
Give it a try.
Enjoy. Yeah, me too. We'll see how it goes.
All right.
Thank you, Dr. Pothof.